More on the World Health Assembly. I'm joined by Kate Tulenko. She's the CEO of Corvus Health, a global health firm, and it's really interesting watching this whole virtual assembly play out. It's kind of something we never really expected to ever see, right, Kate?
Exactly. The World Health Assembly is usually a 2-week-long affair with lots of different meetings and side meetings and events. And now it's just being combined to 2 days on the virtual stage because they only want to address a few issues with COVID before going back to the COVID response.
And Kate, I guess one of the big headlines, China stepping up, President Xi pledging billions to help. At the same time, the U.S. is cutting funding for the WHO. Talk to me about how this is going to play out in the court of public opinion, do you think?
Well, I think the proof will be in how the WHO changes. So the WHO has already announced that they will set up a WHO foundation in order to raise a more diverse funding base for themselves. So it won't just be the donations of the sovereign governments or the donations of private groups such as the Gates Foundation. And I don't think, they haven't really announced yet, that they will accept money from for-profit groups such as medical device companies or pharmaceutical companies. So that remains to be seen. But certainly WHO does need more reform. For example, its headquarters should probably be moved from Geneva to a country in Africa so they can be closer to populations that need health improvement. And their operations can be made more cost effective. For example, WHO staff probably should travel economy class rather than business class. And they can also tap into local labor markets more, so hiring people more affordably at the local level rather than at the international level.
President Xi also saying he supports calls for an investigation into the handling of the pandemic, but he feels like it should come after the virus is contained. It does seem like if you're trying to contain this virus around the world, that should be the focus in many respects, don't you think?
Well, so there will probably be a vote tomorrow during the World Health Assembly on launching an investigation. The EU and Australia have put this resolution forward. And, it does make sense, when the outbreak is still hot, that be towards actually containing the outbreaks, but there probably is some preliminary work that can be done now to look into more what happened. We do know a little bit more. For example, the first cases in Wuhan probably were in November rather than December, and issues of how much local officials knew and when they knew it.
Yeah. There was some encouraging news out today about advances in coming up with a vaccine. What should we read into these comments? I imagine a lot of times we just glom onto these specks of information. We get all excited about it, and then, it's still early, right?
So billions of dollars have already been invested in COVID vaccines, and there are 100 vaccines in development right now, 8 that are currently in human testing. So Moderna, which is a US-based pharmaceutical company, announced today that their phase 1 human testing, in which they gave 45 people, healthy people, 2 doses of the vaccine, that 2 weeks after their second dose, they had antibody levels against COVID high enough to neutralize the antibody, so that to neutralize the virus. So that is very encouraging. And in a few weeks, they will go into phase 2 testing. The Oxford group in the UK has announced that they think that they can have millions of doses of their vaccine available by September. So wow. It looks very encouraging.
We only have about 20 seconds. I have to ask you about the U.S. president talking about this hydroxychloroquine. He says he's taking it. What do you make of that?
I think it's because he was exposed by his valet who was positive. Hydroxychloroquine is not without side effects. And so in order to put the U.S. president on that medication, there had to have been a high-risk exposure.
Interesting. All right, Kate, thanks so much for joining us. Really appreciate it.